A distinguishable and driving force within the Venus Medical Conference arena, known for its knowledge, skill innovation, and modernization, is the International Vein Congress. The IVC has marketably positioned itself as a leading vein conference globally.
We are delighted to be returning to the Fontainebleau this year. Everyone knows the Fontainebleau. It's a Miami Beach classic. It's been around since the Frank Sinatra days. About 5-6 years ago, they renovated it. They put $1 billion into it. And now it's a self-contained type of hotel, and that's part of the attraction. So, people come to a medical meeting. Yes, we're going to, be in a conference room much of the time learning, but we want to, have an environment to relax afterwards and kind of enjoy themselves. So the Fontainebleau is all that. It's on Miami Beach. It's a huge structure. It's got wonderful restaurants inside. It's got all the beautiful people of Miami at nights. The bars are hopping. So the people that come, they have a great time during the day learning new things or old things or just, beefing up their information. And then at night, they usually go out to a nice dinner. It doesn't have to be in the Fontainebleau. We're 25 blocks of famous South Beach, where there's wonderful bistros and the beach. People like Ocean Drive and seeing the scenes. So all that's here. But when we picked the Fontainebleau, we felt it was important to tie the meeting experience to a vibrant city and a vibrant scene so that people have something to do, at night.
My first year, we had about, I'd say, 500-600 doctors. Now we're over, I'd say, 1,000. Especially now being in beautiful South Miami and at the Fontainebleau, which, had $1 billion renovation. It's a great spot to have physicians come down and their families stay for the weekend. As well, for us with booth traffic, it's really increased. And with increased booth traffic, that means increased sales for Venus as a company, and it really helps us get new practices up and running. And that's what Dr. Almeida's done with us with the IVC.
It just allows us to showcase our services to the physicians. We're one-on-one with them. You can speak to them directly. Sometimes it's hard to get through to a physician on the phone or even face-to-face. So they're here, they want to learn about your products and services, and it just makes it a much easier way to get to the right people.
The IVC's attention to details guides its determination to make information sharing easily available for all those that attend. Seeking improvements in experiences and products for vein care professionals, the International Vein Congress has created a hothouse for launching knowledge-based information and premium brands.
IVC is now in its 11th year and continues to grow. Why does it grow? Why is it still attractive? Well, part of the challenge of course directors to keep things germane, keep things relevant. People want to go to a meeting and be able to implement what they've learned as soon as they get home right into their practice. And if they can go home with 3, 4, 5 pearls that they can implement immediately, I think that's a successful meeting for somebody coming to learn something new. The meeting has changed in the last 11 years. Really, the onset of this was the office-based arena and how we were taking traditional stripping surgery out of the hospital into the office with the technologies that were new at that time, which are the ablation procedures, endovenous laser ablation, endovenous radiofrequency ablation. But that's 12 years ago. Now we're seeing an explosion in technology and devices in the deep venous system, how to manage post-thrombotic disease, patients that have had previous deep vein thrombosis, patients that have pulmonary embolism, the new medications to manage clot, the new devices to manage clot, the balance between the office and the angio suite that one may need if they want a comprehensive vein practice. And while early on, and frankly, we added some levity to the meeting in the early days because veins have always been kind of uninteresting to people. Certainly in my field, vascular surgery, veins were always the bastard stepchild of vascular surgery. So when we started this meeting 11 years ago, we had some entertainment in there, some jokes, and try to keep the meeting fun and exciting. However, it has grown into something serious. We got some serious people discussing some serious problems and how to manage them. If you'll note in what we're putting forward this year is veins and balance. And that's important because we've always talked about balancing lifestyle and how people like vascular surgeons, thoracic surgeons, cardiologists were just mired in emergencies and getting called into the hospital at night, that a venous practice is a little more soft, it's more elective, not so many emergencies. One can have a life, so to speak. The night call is not strenuous like arterial surgery. And we've carried that balance forward from lifestyle to managing a field now that has multiple specialties fighting in the same turf. We've got vascular surgeons, interventional radiologists, interventional cardiologists, phlebologists, anesthesiologists doing veins, everyone in the same sandbox and trying to figure out each other's place. And we certainly address that in the meeting, the rosy parts and the not so rosy parts. So balance in veins is key, I think, to happiness. And I think that's why the meeting's been successful. We talk about incorporating the venous lifestyle, so to speak, everything that comes with it.
Delivered by national and international experts in the field of venous care, the IVC combines the latest evidence-based information and treatment options with its valuable vision into the best and most important approaches advancing this growing field of medicine today. The International Vein Congress strives to upgrade industry professionals' knowledge base and skill level, giving everything needed in one dynamic medical congress experience.
The culture are people that, number one, enjoy Miami, they enjoy good lectures, they enjoy the live cases. I think in the evaluations, that's always the strongest point, are the live cases. We do live demonstrations from my operating room in my office and broadcast it into the main auditorium at the Fontainebleau. And it really gives a feeling that one is inside my operating room there with me, and we kind of detail out the points of the cases. And there's no way to do that in a lecture. The live case, really, we throw all the little wrinkles that one may see in their daily practice, how to handle them. For example, kinked veins, neovascularity, when and where not to place foam. What is a good vein for our radiofrequency ablation? Which vein may be more suitable for laser ablation? What is better for phlebectomy? All these things. And yes, the PowerPoint presentations play a role, but certainly live cases, case discussions, live ultrasound. We try and incorporate all that. We bring in the business aspects. If you can't manage your office, you're going to go under. So one does need some certain skills to manage an office, how to run a venous practice, how to get a patient through your system and keep them happy and sending other patients. So that's the culture we've created. It's clinical, it's business oriented, it's lifestyle oriented, it's about balance. And I think that's why we've been successful, because I do think it resonates with doctors that come here.